Welcome to the explainer. When a toothache strikes, it can just completely hijack your entire life. But what if you had a structured mental model to handle it? Well, today we're doing exactly that. We're taking clinical guidelines and unpacking them into a practical, step-by-step survival guide. So whether you're dealing with a dull ache or literally a knocked out tooth, you're going to know exactly what to do. Let's dive right into it. 4 grams. Okay, we need to establish the high stakes right out of the gate here, because this number is absolutely vital. 4 grams is the dangerous daily limit for paracetamol in adults. Think about it. When people get a raging toothache, they get desperate, right? They start self-medicating, taking a pill here, a powder there. What they don't realize is that paracetamol is hidden in countless over-the-counter cold and pain meds, and accidentally crossing that 4-gram threshold, which is about 75 milligrams per kilogram in a 24-hour period, can silently cause fatal liver damage. So before we even look at a tooth, we have to recognize that mismanaging dental pain can quickly become a literal medical emergency. So here's our roadmap for this explainer. 1. Red flags and medical emergencies. 2. Navigating dental pain. 3. Swelling and bleeding. 4. Trauma and abnormalities. And finally, number 5. The self-care toolkit. Let's get to it. Section 1. Red flags, medical emergencies. We are starting right in the red zone. This is where symptoms require immediate emergency medical help. The very first question you have to ask is your airway compromised? If you or someone else is having difficulty breathing, hearing a high-pitched breathing sound that's known as stridor, having trouble swallowing, or suddenly speaking with a hoarse, muffled voice, you are completely out of the dental realm. These are immediate, life-threatening red flags indicating that an infection or swelling is blocking the airway. Seriously, do not pass go, do not call the dentist. You need to get emergency medical help right away. Another totally critical non-dental red flag is a stroke. Sometimes a patient will come in with altered sensation in their face, or their face just looks abnormal. And naturally, people assume, oh, it's a damaged dental nerve. But before you assume it's a tooth issue, you absolutely must screen for a stroke. Just remember the FAST acronym. Look for facial asymmetry, arm weakness, and speech problems. If any of these are present, it is a medical emergency, not a dental one. Section 2. Navigating dental cool. Okay, so once we've ruled out those life-threatening red flags, we transition into the amber zone, severe dental pain. If we look at the top of the pain pathway flow chart, it's actually fascinating how it structures the panic. Before a clinician even asks which tooth hurts, they check for atypical jaw pain. Why? Because surprisingly, jaw pain can actually be a sign of a myocardial infarction, a heart attack. No way, right? They also check for that paracetamol overdose we talked about earlier. Only after clearing those major systemic risks do we follow the flowchart down to the tooth itself, figuring out if the patient needs urgent dental care or if they can just manage with safe self-care at home. So what's usually causing that classic agonizing toothache in the first place? Well, it's a condition called pulpitis. To cut through the jargon, the pulp is simply the soft tissue and nerve deep inside your tooth. When that pulp gets inflamed, usually from a deep cavity or some kind of trauma, it swells up. But here's the catch. The nerve is trapped inside a hard, rigid shell of tooth enamel, so the pressure has literally nowhere to go. And that trapped pressure, that is exactly what causes that intense, hyper-specific pain. But you should know that not all pulpitis is created equal. We divide it into 2 camps, reversible and irreversible. If you get a sharp pain when you drink an ice-cold glass of water, but it fades away pretty quickly, that's likely reversible pulpitis. The nerve is annoyed, sure, but it can heal if your dentist fixes the cavity. On the flip side, if you've got a dull, throbbing pain that lingers for hours, you can't even pinpoint exactly which tooth it is, and most notoriously, it wakes you up out of a dead sleep at night, that is irreversible pulpitis. The nerve is dying and you're almost certainly looking at a root canal or an extraction. Now here's a massive curveball for you. Sometimes it is not the tooth at all. Trigeminal neuralgia is this rare, terrifying condition that causes sudden, episodic, just excruciating shocks of facial pain. It usually hits one side of the lower jaw or cheek and lasts just seconds or minutes. Patients are absolutely convinced it's a dental disaster, but it's actually a nerve disorder. Catching this is crucial because pulling teeth won't stop the pain. It requires an urgent specialist medical referral. Section 3. Swelling and bleeding. While pain is obviously invisible, our next 2 symptoms are highly visible. And the swelling pathway flowchart shows how urgency is totally dictated by speed and location. So a slow-growing, hot, firm swelling on the gum, that probably just means you need urgent dental care and maybe some antibiotics. But if the swelling is rapidly increasing in size, if it's pushing the floor of the mouth up, or if it's creeping up and closing the eye, that is a spreading infection that has crossed into a red medical emergency. Seriously, do not wait around for a dental appointment if your eye is swelling shut. One of the most frequent causes of localized swelling, especially if you're a younger adult, is pericoronitis. This happens when a tooth, usually one of those stubborn lower wisdom teeth, only partially erupts through the gums. It leaves this little flap of gum tissue just resting over the tooth. Food and bacteria get trapped under that flap and boom, you get a painful infection, limited mouth opening, and a genuinely horrible taste in your mouth. That inflamed flap is the classic telltale sign of pericoronitis. Now, if the swelling isn't from the gums, it might be from the root. An acute apical abscess is basically the nightmare progression of a dead tooth nerve. The infection pushes out of the tip of the tooth root and forms a pus-filled swelling in the bone and gums. The signs are super clear. Localized severe pain that gets worse when you bite down, visible swelling, the tooth itself might actually feel loose or mobile, and you might even run a fever. This is a situation that requires urgent drainage by a dentist. The other highly visible panic trigger is bleeding, which almost always happens after a tooth extraction. But the bleeding pathway makes a vital distinction we need to talk about. A little oozing? Totally normal. But if the bleeding is brisk and persistent, that's a problem. The crucial point on this flowchart is assessing if the patient is on blood thinners, medications like warfarin, aspirin, or apixaban. If they are, and 20 minutes of biting firmly on gauze hasn't stopped the bleeding, they need emergency care immediately. Section 4. Trauma and abnormalities. So what do you do when your mouth takes an unexpected hit? Well, the trauma pathway shows clinical discipline in action. When someone takes, say, a baseball to the mouth, everyone's instinct is to immediately panic about the broken teeth. But the guidelines strictly prioritize. First, was there a loss of consciousness? Is there a serious head injury? If yes, that's an immediate 999 call. Next, control any residual bleeding. Third, and this is so important, did they inhale a broken tooth fragment? Only after we know the brain and airway are 100% safe do we worry about fixing the cosmetic damage to the smile. But what if a whole adult tooth gets knocked clean out? Remember this, time is tissue. Step 1, if it's an adult permanent tooth, try to gently push it right back into its socket immediately, but without touching the root. Step 2, have them bite on a clean cloth or even tinfoil to hold it in place. Step 3, if you absolutely cannot get it back in, store it in a glass of milk or the patient's own saliva while you rush to the dentist. Do not use water, it will damage the cells. And here is an absolute golden rule from the guidelines. Never, ever try to reimplant a primary baby tooth. You can permanently damage the adult tooth growing underneath it. Let's talk about a different kind of trauma, the trauma of a healing process gone wrong. Alveolar osteitis, which is universally dreaded as dry socket. Usually 24 to 48 hours after you get a tooth pulled, a blood clot forms to protect the underlying bone. In a dry socket, that clot either fails to form or gets dislodged. The raw bone and nerves are just exposed to the air. It causes an absolutely terrible radiating pain. And the source data is crystal clear on this. If you are a smoker, your risk of developing a dry socket absolutely skyrockets. Section 5. The Self-Care Toolkit. While you're waiting to get to a dentist, how do you actually manage these issues safely at home? The guidelines suggest some brilliant strategies. For an erupting tooth, stick to soft brushing around the sore area. For an extraction site or a dry socket, gently rinse with warm salt water. But definitely avoid rinsing on the exact day of the extraction so you don't accidentally wash that crucial blood clot away. Interestingly, the guidelines specifically warn against using chlorhexidine mouthwash for dry sockets. Even though it's antibacterial, there are reports of it causing very rare but potentially serious allergic reactions when it's used deep inside a socket. And for minor trauma, like a sharp wire on your braces tearing up your cheek, just stick some malleable dental wax right over the sharp part. I really want to highlight this specific quote directly from the guidelines regarding painkillers. Do not place tablets next to the affected area because this can damage the tissue. You'd be surprised how many people try to place an aspirin directly on their sore gum, hoping it will just numb the tooth. Aspirin is literally an acid. Placing it against the soft tissue of your gum will cause a severe chemical burn, adding a massive painful ulcer right on top of your toothache. So please always swallow your painkillers. Well, we've covered how to survive the storm, from identifying airway red flags and stroke symptoms to safely managing pain and knocked out teeth at home. But as we all know, the best emergency playbook is the one you never actually have to use. So I want to leave you with this provocative question to think about. Knowing the pure misery of irreversible pulpitis and dry sockets, is your current daily dental hygiene routine really enough to prevent these emergencies from happening in the first place? Thank you so much for exploring this with me today, and keep that playbook handy.